Having looked at dysfunction and briefly discussed the injury cycle, in this section we will discuss injuries more specifically, what they are, how they're caused, mechanisms of injury, and ultimately how this affects you as a therapist. Ultimately, an injury is damage to the soft tissue caused by factors either internal or external to the body. As a therapist, it is essential to understand injuries, as it is often a client's primary purpose for visiting. But by also understanding the injury process and biology of repair, you are likely to make any treatment or referral more effective. It is important to point out here that as a level 3 therapist, you are not qualified to treat an injury site, although you can support and treat areas around that site. Injuries should be referred to a more experienced level 4 practitioner or an alternative field, such as a physiotherapist. Injuries occur when the soft tissue structure is exposed to forces that it cannot absorb. These may be postural that build up over time, or an external force, such as twisting an ankle or impact of a fall. As there are such a large range of causes, we are able to categorise injuries. The first category are primary injuries, which occur as a result of the original trauma, and normally have an identifiable source. These can be further subdivided into two categories: intrinsic and extrinsic. Intrinsic injuries are those caused by forces within the body, be that short and tight muscles, excessive compensation, or weakness. They most often occur during a dynamic activity, such as a hamstring tear during a sprint, a short tight calf which causes pain after running a certain distance, a repetitive strain injury that is caused by muscular dysfunction, or a strain to the lower back while lifting an item. Extrinsic injuries, in contrast, are caused by factors outside of the body. This might be a direct impact or an impact caused by an external factor, and can be deliberate or accidental. They are further subdivided into 4 subsequent categories. These are human, such as a direct hit during a rugby match; implemental, such as dropping weights on your foot; vehicular, such as an impact with a car; or environmental, such as tripping over loose items. Secondary injuries are, as they say on the tin, subsequent to the primary injury, usually caused by compensatory posture or movements. Someone will often say in a consultation that they don't know why they have a problem. I had a lady I worked with who had plantar fasciitis, or pain in the base of her foot, with no known cause. As we talked and worked, it turned out that she had had a motorcycle accident, landing on the opposite shoulder to her foot. On testing the movement, we found connections between the two areas and therefore treated the shoulder, which had huge effects on the foot. This is an extreme example, but it shows how often one injury will be linked to another, and often people will not link the two. One aim for massage will be to prevent these secondary injuries through maintaining muscular condition. The next category of injuries is non-consequential. These are injuries or conditions which are not caused by sport or activity, but which nonetheless interfere with participation. They could be, for example, a hereditary spinal condition. As a result, they are often seen as conditions which restrict participation. Perhaps not at a low level, but they will often present as a problem when intensity or level of activity increases. Massage therapists will often be effective in managing these conditions, as with careful maintenance and treatment, these can be managed to prevent future injuries and ensure activity can be continued. With all injuries, whatever type, it is important to consider the mechanism of injury, or MOI, which is basically the cause of the injury. If you are able to identify the mechanism of injury, particularly where it is postural, you may be able to break the injury cycle. This might be through developing an effective and targeted treatment plan, or creating more targeted aftercare. It will also give you a better idea of when to refer. If you are able to start to identify these factors and effectively address them, you'll become a much more effective therapist. There are a few key types of injury that we need to look at. The first are skin injuries. The MOI will determine the type of damage to the skin, and these are normally visual. It is important to note that any skin damage should not be treated through massage. Grazes are caused by anything rough or hard rubbing against the skin, while a cut is a piercing of the skin when it is punctured by something sharp. Burns, meanwhile, take various forms and can be caused by heat, friction, sun, electricity, chemicals, or flames. The level will determine if there is simply redness or blistering. In severe cases, there can be damage caused to the underlying tissues. It is also important to consider typical muscle and tendon injuries, and we are able to classify them based on their severity. Any damage to the muscle-tendon unit is called a strain. Muscle tendon injuries occur when the muscle tendon unit is overloaded and tears occur, either over a few fibres or a much larger muscle area, with damage most commonly occurring at the point the muscle extends into the tendon, the musculotendinous junction. Depending on the level of damage, we will define the injury as a grade 1, 2, or 3 strain. A grade 1 strain is the least severe. It will mean that less than 5% of the muscle fibres are damaged. In this case, the individual will have very mild symptoms. There may be some low-level pain on palpation and on movement, mild swelling, and possibly mild bruising or redness. People will be able to continue to function normally with an injury of this level, and you will be able to massage and increase the rate of recovery, although typically this will be quick in any event. A grade 2 strain is a large category, where between 5 and 95% of the muscle can be damaged. As it shows a range of damage, there are a range of symptoms, which can be more or less severe depending on the injury. In this case, individuals will present with more significant pain, especially on palpation or movement. There will often be a lump around the torn fibres, and as a result of pain and inflammation, there will be a significant loss of function in that area. Swelling will be more severe and visible, with signs of bruising and redness. Typically, recovery from this type of injury will be much longer, as the inflammatory and remodelling phase will also be lengthened. You'll be able to work with these clients at level 4, but at level 3 it is important to improve recovery by increasing circulation in surrounding areas and supporting other structures to prevent secondary injuries. The most severe strains are grade 3, and these involve damage to more than 95% of the muscle. Often the muscle tendon unit will be completely ruptured. As a result, there will be severe pain, swelling, bruising, accompanying a large lump in the area as the tissues bunch up. There is invariably a complete loss of function. When you first see this type of strain, you will know, as there is often a large hollow dip next to the curled up muscle. You will not be able to work with these injuries in their early days, although supporting surrounding tissues remains important to prevent secondary injuries from occurring. Tendons can become damaged independent of the muscle unit, and these injuries are classified as tendinopathies and include overuse injuries, tears, microtears, and degeneration. Tendons are designed to act as levers for the muscles and therefore have limited stretch, although they are able to expand by about 4 to 8% of their original length before recoiling due to the presence of elastin fibres. Overuse injuries occur when these limits are repeatedly reached, while stretch to over 8% is likely to cause it to rupture. Tendinitis is inflammation of a tendon and usually describes the first stage of injury. Often this can develop into a chronic condition. Be it the first phase or chronic, any inflammation is referred to as tendinitis. Tendinosis, however, is the degeneration of a tendon without any signs of inflammation. It is difficult to identify a mechanism of injury, as onset is normally very slow. Often symptoms are slow to build, or the condition will be asymptomatic until the more serious condition occurs as a result of degeneration. It is also important to consider ligament injuries. These present in a similar way to the muscle tendon injuries, in that there are 3 levels with worsening symptoms. In fact, these follow the same pattern. It is important to note that ligament injuries, however, are called sprains. You will not be able to massage the ligament directly very easily, although this might be beneficial to assist with the remodelling of scar tissue. Your treatment approach should be to support the individual to regain movement, and therefore maintaining the condition of the muscles is really important. Sprains differ from strains in that with an increasing severity, there will be an increase in joint laxity. The final key category to consider are capsular ligament or joint capsule injuries. These are also classified as sprains and present similarly to a grade 2 or 3 injury. If damaged, synovial fluid may be produced or escape the joint capsule, causing swelling. These injuries are particularly important to refer to a specialist, as where the capsule is damaged, should any fibrous tissues or adhesions develop within the joint capsule, then the long-term function of that joint may be severely compromised. So having discussed these common injuries, their causes, and how to categorise them, it is important that you understand them and how you as a therapist can interact with them. An understanding of this will mean that you are able to develop your skills and support your clients in injury recovery. Although at level 3 you are not qualified to treat injuries directly, this understanding will leave you in good stead. You can now start to look at the recovery process and how as a therapist you can interact with that.